Hi guys, I'm Nuki. I'm going to be teaching you guys the unresponsive patient assessment today. And this is Kevin, who's going to be the witness. And this is Abe, who is our unresponsive patient. So the first thing that I'm going to do when I arrive on scene is just make sure that the scene is safe, make sure there are no hazards to Kevin or myself, or any more hazards to Abe here. And then I'm going to have my BSI on, safety glasses on, which I'm keeping on my forehead because they get quite foggy. And yeah, so I'm going to introduce myself. Hi, I'm Nuki with Ski Pattol. Can I help you? So Abe is not responding, so I think he might be unresponsive. I'm gonna ask my witness here, Kevin, what happened. Kevin, you know what happened here?
Abe fell on his head.
Okay. So the first thing I'm gonna do is just check for a carotid pulse right here, and check for breathing sounds. So there are good respirations and a strong pulse, so I know that he's kicking. Next thing I'm gonna do is ask Kevin just to take head stabilization. He's unresponsive and he fell on his head, so we think that there may be a C-spine injury. So Kevin, I'm just gonna ask you to hold the head just like you are and make sure that there's no movement so we don't move his spine anywhere, okay? All right. So the next thing we're gonna do is just assess his responsiveness according to the AVPU scale. So AVPU is A for alert, V for verbal, P responsive to pain, and then U unresponsive. So we know that he's not alert. He's not responsive to me talking, so he's not responsive to verbal. We can check for pain in a couple different ways. First one's just doing a little chest rub right there, right on his sternum. We can just pinch his skin up here, or we can pinch his earlobe, and if he's responsive to pain, he'll probably either flinch or make some kind of sound. So when we do that, we get no response. So we know that he is unresponsive. The next thing I'm going to do is just check his circulation in all of his limbs. So I'm going to feel for radial pulse here, and then the other side as well. I get strong pulses in both sides, and then we would just check for warmth in his ski boots. And then as I'm doing this, I'm also assessing his skin, which is pretty cool and clammy. So that's a sign of shock, which would mean that we're going to be calling for oxygen when I make my radio call. So now that we've done all that, I'm going to actually make my radio call. So come in top hut.
Go for top hut.
I have an unresponsive adult male patient on the Lang. I'm going to need a backboard O2 and extra patrollers.
Top hut's responding.
All right.